Hello, everyone. My name is Tiara Brooks, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Identifying Adolescent Victims of Human Trafficking. This interactive webinar will cover signs of trafficking and sexual exploitation among adolescents, young adults, strategies for providers and staff to support trafficked and sexually exploited patients, and resources for providers and health center staff. Here at School-Based Health Alliance, we believe that all our children and adolescents deserve to thrive. We connect to our sector to a national community of peers. We support our field with common standards, measures, data, and research to effectively demonstrate their value. We advocate at federal, state, and local levels for the concept of health and education partnerships. We provide the field with high-quality resources, training, and motivation and inspiration to excel in their work. When health and education come together, great things happen. Now, before we begin, we do have a few housekeeping reminders. All attendees are in listen-only mode. However, we do want to hear your questions. To ask a question at any point during the webinar, please use the chat tool located in the Zoom control panel. We will address questions following the presentation. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archived webinars, such as the ones you are currently viewing on your screen. Our presenters today are Lauren Rinaldi and Jenny Lane. Lauren became the director of the newly formed Adolescent Health Initiative in 2013. Her previous leadership experience includes roles with federally qualified health centers and community-based organizations in Illinois and Michigan. She previously served as vice president of the Michigan chapter of the Society for Adolescent Health and Medicine. Lauren is passionate about healthcare, innovation, and meeting the needs of underserved populations. Jenny has worked in the field of positive youth development and adolescent health for the past 20 years in varied settings, including traditional classrooms, outdoor experiential education, sexual health education, and youth-driven peer education and social change programs. She is committed to strengthening youth-adult interactions through expanding adults' capacity to partner with young people in authentic ways. Jenny has a particular interest in the ways parents and healthcare professionals prepare young people for a lifetime of engaging in their own health through dialogue, practices, procedures, and policies. I will now turn it over to Lauren and Jenny.
Hi, everyone. This is Lauren Rinaldi. Just give me 1 second to transfer our slides here. All right. So I'm the director of the Adolescent Health Initiative, as Tiara just said, and I'm going to be facilitating today with Jenny Lane. Part of our work at the Adolescent Health Initiative is to develop trainings and resources for health centers who strive to be adolescent-centered. So today we're going to be discussing how to identify and support trafficked youth with an emphasis on a whole clinic approach. Our expertise is in public health and positive youth development and systems change, though we've consulted with clinicians, social workers, legal experts, including the FBI, community workers, and survivors to create this presentation. So the Adolescent Health Initiative is based out of the University of Michigan, but we provide training and technical assistance, consulting, and resource development to healthcare providers, health systems, and youth-serving organizations across the country. And our website is listed there below. We'll be showing it to you again at the end of this presentation with some additional resources. On today's webinar, we're going to be talking about some of the ways that people of any role in a healthcare setting can identify signs of trafficked and sexually exploited youth. We'll also look at some of the misconceptions about human trafficking and consider ways that we can support victims. I want to acknowledge that it can be uncomfortable for some people to talk about young people being exploited, so please take care of yourself as needed. And human trafficking is a really complex topic, so we encourage everyone to continue the learning and discussion beyond today's presentation. There are a lot of challenges in identifying and supporting trafficking victims, and unfortunately, not a lot of easy answers. But we're going to do our best to consider what we can do in this brief discussion today. So at the conclusion of this webinar, attendees will be able to identify signs of trafficking and sexual exploitation among adolescents and young adults and describe strategies for providers and staff to support trafficked and sexually exploited adolescents. So I'm going to turn it over to Jenny now to get us started.
So we're going to start with the basics, but then we're going to dive in a little bit more in detail. And certainly, while we are approaching this with a whole health center approach and thinking about how various roles can play a part in supporting and identifying trafficked youth, we're also really going to share some really concrete practices and strategies that are provider-centered as well. So for the providers on this webinar, we will have plenty for you. I said all that to say that we're going to start on this to get on the same page with some of the basic definitions. And you'll notice in this diagram, we've got the two types of human trafficking, labor trafficking and sex trafficking. And a lot of times when people hear the term human trafficking, they think that it only refers to people being moved across borders. And while it's true that people are brought from other countries to be exploited here in the US, and that happens a lot, much of what we see in human trafficking involves US citizens, and many of them are teens. So a victim does not need to be physically transported from one location to another to be trafficked. And on this webinar, we'll be discussing both sex trafficking and labor trafficking. So next slide. Okay, so you can see from these definitions that both labor and sex traffickers use the same kinds of force that are outlined in the gray text as violence, threats, lies, and/or debt bondage to get people to do sex acts or other kinds of work against their will. So there are special kinds of laws that are designed to protect youth under the age of 18 who are involved in sex acts for money. So these laws vary quite a bit from state to state, and they can be complicated. There are resources that are in a handout that we're going to be sharing on the website after this webinar if you'd like to do additional learning about your state, keeping in mind that the laws do change. So we know that adults who do sex work can be criminally charged for prostitution, even if they're being forced to do it against their will. So many states, though, have passed safe harbor laws to protect minors from being charged with prostitution. Usually, minors who do sex work are either being exploited by an adult or they're engaging in what's called survival sex, where they're acting on their own and they're using the income from sex to survive. In the states that have safe harbor laws, survival sex qualifies as trafficking, and the person who pays them for the sex is considered the criminal. In these states, it can be reassuring for minors who are afraid of coming forward to know that they may have legal protections. But the system is definitely not perfect, and it's far from it. And child advocates are still working to decriminalize survival sex for minors and sex trafficking for minors in all instances. So a word about language. You'll notice that when we discuss the trafficking of minors, we usually use the term victim. So with other types of abuse, such as interpersonal violence or sexual assault, there's been a shift toward the term survivor as a way to define someone by their strengths. With human trafficking, the term survivor is usually reserved for someone who has survived trafficking and is no longer being trafficked. The term victim makes it clear that a young person is being victimized by someone who is doing them harm. Well, that's a little bit of a shift. I have to say that was a shift for me just to kind of get my head around that, but once it made sense that, that they are the person who's being victimized, it really helps illustrate that. So let's take a look at labor trafficking first. And I think a lot of times people think of sex trafficking first when they think of human trafficking, and I think it may partly be because it's in the media more. So like if you think of the ripped from the headlines, CSI, SVU kinds of shows, or the actual headlines of celebrities that have been accused of exploiting minors, But labor trafficking might not be on our minds as much, so it can be helpful to consider some of the many ways that labor trafficking can look. So labor trafficking can target young people through employment opportunities that seem too good to be true. So sales crews, like the ones that have young people stand on a corner or go door to door selling expensive magazines, are the second most reported labor trafficking industry on the National Human Trafficking Resource Center hotline. Their report states that sales crews typically recruit U.S. citizens ages 18 to 25 with promises of travel, a carefree life, and the ability to make a lot of money. A crew consists of an average of 3 to 40 youth under the direction of a manager who moves the crew from city to city every few weeks. Crew members receive a small daily stipend of $8 to $15 or less to cover the cost of meals and personal items. Violence, sexual assault, sexual harassment, pressure tactics, and abandonment in unfamiliar cities is common. Traffickers are especially looking for youth whose tangible needs are not met, so that they can fly them to another location, isolate them from family and friends, provide substandard housing, and exploit them for manual labor like construction, agricultural work, or cleaning, with poor work conditions and long hours. Undocumented immigrants are especially vulnerable to being trafficked, as a trafficker can threaten to report them or a family member as an exploitation tool. So next, we're going to watch a clip from the perspective of a young man who was trafficked. Throughout this webinar, we're going to be watching some short video clips. And in our work at AHI, we think it's essential to hear and learn from the populations of youth that we're hoping to support. As you view the clips in this webinar, consider what makes each survivor vulnerable to being trafficked. When we think about it in this way, this can help us keep our radar up for anticipatory guidance when we recognize that an adolescent might be especially vulnerable to being trafficked, and also to notice the signs of trafficking. So hopefully you have
We spoke with some teen workers, but they were afraid to go on camera. Finally, one agreed if we concealed his identity.
El primer día cuando llegué ya no quería regresar porque era durísimo, hacía mucho frío y estaban pesados los carros que sacábamos del cooler. Las máquinas son bien afiladas y si uno no mira bien las cosas, mete uno la mano y lo corta todo. Estábamos trabajando. Sabíamos que íbamos a salir a las 10 porque ya sabíamos que ya es ahora, ya es la hora de salida, pero llegaron y ya no se pueden ir así a la hora, a las 10 porque tenemos mucho trabajo y tenemos que sacar el pedido. Y me dijeron que tenía que salir hasta las 12 de la noche.
Y cuando me dices que te dijeron que no podían salir, o sea, que cerraban las puertas o...
Sí, porque son contratistas que te pueden sacar o te pueden meter como ellos quieran.
¿Y los contratistas sabían que eran menores de edad?
Sí.
A veces cuando veías a otros menores, ¿les platicabas o te sentías, pues sabías cómo se sentían?
Sí, pero como tienen deuda, como lo tuve yo, pues no tienen opción de salir porque tienen que pagar esa deuda. Por eso siguen trabajando ahí. Aunque tienen las ganas de salir, pero la deuda los empuja a trabajar.
To date, we found no one in law enforcement who has investigated or intervened here. And people we spoke to said they'd heard of at least 30 teens working in plants in this area of Iowa, paying off debts, working long hours, unable to leave their jobs, just like the teens in Ohio.
that was a 2-minute clip from a PBS special, a Frontline special. And in the interest of time, we're including a longer set of vignettes that are going to focus on undocumented trafficking victims at the end of the slideshow and with the archived webinar, so that you'll be able to access if you want to see more of them. So now we're going to take a look at some of the key places that traffickers look for vulnerable youth. And this is probably not a surprise, because some of these are sort of the kind of conventional view of where trafficking happens, like malls, bus stops, youth shelters, group homes, and even schools. And then, of course, the internet. And so now we're going to take a moment to think about how the internet provides a platform for traffickers to find vulnerable youth, and then also to promote and arrange the commercial transactions. So Backpage, which you may have heard of, it's kind of similar to Craigslist. They used to have a thriving adult services section, and it was all shut down in 2018 because it both encouraged and facilitated the trafficking of minors. So kind of interestingly, of course, shutting down one site that is a hotbed for trafficking means that it eventually shifts somewhere else. So if you do a search for Backpage online, one of the first listings is a discussion board about where to find the girls from Backpage. So, okay, we know that trafficking is out there, but how much do we actually see in health centers? So a study that was published in the Annals of Health Law in 2014 focused on survivors of sex trafficking that were receiving health care. And so the image on the left illustrates that 88% of survivors reported that they had had contact with a healthcare provider while they were being trafficked. The figure on the right represents that 6% of providers report treating a victim of trafficking at some point in their career. And when we include labor trafficking, we're probably seeing even more victims of trafficking than we're even aware of. So we're going to watch another quick video clip of one survivor's account of seeking health services.
The first time I met my trafficker, I was 17, and I was introduced to dancing in a strip club. And then that's kind of the way I kind of entered the dark world of trafficking, which I was in for about 7 years off and on. And I tried to leave, as you know, a lot of people, that's the main question is like, why did you stay? Why didn't you leave? And I tried to leave several times. One in particular, I left one time, and then he actually said, hey, if you don't come back, I'm going to kill your mom and your daughter. At least every couple of months, I would try to go seek medical treatment. I went there to, see if I can, just check to see if I had any STDs, to see if I can get condoms, and also to make sure that I took birth control. But when I went there, no one ever really asked me like what's going on and how come you come in so often. They're not asking why do you want to take STD tests so often. I think there were signs that and questions that they could have asked, but they didn't.
So I'll just say a couple words about the video clips that we've chosen. There are a lot of video clips that are out there of survivor stories. Many of them are really sensationalized, and so we tried as much as possible to find, music that wasn't super manipulative, and so these will be available to you as well as some others. So this slide here with some processing questions about what might keep us from noticing or from asking. I think her interview clip touched on a number of issues that really kind of raise those questions. So if you could take a moment to type into the chat box any of your thoughts about what you think might keep us from noticing. So remember that she went into clinic regularly to seek medical treatment. So anything that you can think of, whether it's to keep us from noticing or from asking the questions that she said that no one asked.
You can do this using your chat box, not the Q&A box, but your chat feature. Yep. Is there anything you'd like to share with me today? Providers' lack of awareness around trafficking, a lack of concern, our own implicit bias or our assumption that teens are willingly sexually active. Yep. Providers not being informed, not wanting to sound judgmental. Being very busy. Awareness, not having a protocol, might be hesitant to ask.
There's some great comments here, and they're coming in.
They're coming in fast.
Yeah. I'm sorry if we didn't read yours, but there's some really helpful ones.
Yep. Not being trained. Doctors may be afraid of how they might be, if they might scare somebody. Seems like you're being rushed in and out. Great. This is really helpful.
Yeah.
Great comment.
And I noticed one of the comments was about just short visit times, right? And sort of kind of your eye on the schedule, and it can take an intent to pause and step back and look. And thinking about some of the other issues people raised, the intent to get training, the intent to recognize implicit bias, all of those components that are barriers for us really take an intentional effort, which you're doing right now. So yay you.
And a lot of the comments that are coming in are about not knowing what to do if you find out that someone is being trafficked. And so that might prevent you from asking some questions. So we're going to try to give some attention to that later on in this webinar.
Yeah. Thanks for sharing those. That was really helpful. Okay, so we're going to move on to take a look at some of the developmental characteristics of adolescence that can be really helpful to kind of think about in the context of trafficking. So, of course, my caveat is that not all adolescents experience these characteristics in the same way, but you can see why adolescents are particularly at risk for being trafficked as sort of an age group that's vulnerable. Especially when you introduce an age disparity with a trafficker and the power differential with that. So we know that they seek new experiences. Adolescents want to be independent. They're set up neurologically to want to take risks, and they're motivated by attention, some of them, influenced by social media, curiosity about sex, and of course, because of the neuroscience tells us that often their short-term thinking is, or their thinking is more focused on short-term. So I will also add the caveat that it's worth a mention that people of all ages can be victims, but it's helpful to be thinking about how these characteristics of adolescence might compound this. And when we add the social determinants of health, discrimination, and environmental factors to the developmental factors that we just discussed, we get an even more complex picture. Starting at the top, young people who are involved with children's protective services or foster care are at a significantly higher risk of being trafficked. Family dysfunction might look like a lack of adult supervision, abuse, or neglect. And youth who run away from home, who have been involved in gangs, have a substance use disorder, or live in poverty are all more vulnerable to trafficking. And lesbian, gay, bisexual, transgender, queer, or questioning youth are at higher risk for trafficking because they're more likely to face family rejection and discrimination. So here we have another clip. This one is about a minute in length, and it's an excerpt from an interview, and it helps illustrate one young woman's experience being trafficked and the lack of support that she had from professionals and systems.
Life. So can you tell me a little bit about your experience just kind of dealing with the government care system?
I think the government care system is broken. And I think that there's a lot of situations where it's like we as, children that's in the foster care system, we don't know where we're supposed to be either. It's like literally you don't know what home, you don't know where you're supposed to be. Okay, I was here last, but then when I went back there, she told me she don't have me no more. So it's like, okay, do I go to the social worker and turn myself in? Because if you run away from your foster home or you run away from anything, you are considered a runaway youth, which you can get arrested for.
Right.
And my social worker switched so many times, so no one knew who case it belonged to.
Do you know how many times it switched?
Probably like 5 to 6 times. I don't know. Because every time I thought that a certain lady was my social worker, and they was like, no, this person your social worker, no, this person your social worker, no, this person. Because it's just too many cases.
Do you feel like kids in the system are easier targets for people who are trying to exploit them?
Yeah. I think any kid is an easy target that don't know how to love themselves or wasn't provided with love and care.
So Ashley brought up quite a few points that are sort of structural issues, as well as how it felt for her to be kind of just a pawn in that kind of system and just moved around, and how frustrating that can be for her as a survivor. And I know that for all of us who work with young people in systems that we recognize are not functioning effectively and not efficient, it can be really frustrating for all of us as well. So as we consider the frustrations and limitations of the systems in which we work, let's just reflect for a moment individually. We're not going to do a chat about this, but how can we individually help reduce barriers to support vulnerable youth? So if we were seeing a patient like Ashley who had been in the foster system, and incidentally, her longer video clip, she does share a fair amount about her experience being trafficked as well. It can be really helpful for us to think about what are we doing to help reduce those barriers by connecting young people to services and making sure that we have warm handoffs for those services. And whenever we have integrated behavioral health and those kinds of resources there that we can maximize, and then considering how connected we are to our community resources, and we have a robust list of community resources that we can share. Incidentally, we have a template for community resources around trafficking that has a section for national resources, and then it has a section for you to write your own local community resources in it that we'll also share as part of this, the archive. Okay, so we just identified, and you all identified in some of your comments about the last chat, but what some of the challenges are, and they are significant and many. So looking at it from a victim's perspective, many don't self-identify as someone being trafficked. And so even if a provider is the most well-intentioned and really asks them in all the right ways, they may not identify as someone who is a victim or as someone who's being trafficked. And that is certainly part of the challenge and what's one of the things that complicates this so much. Many are not ready to disclose or don't want to disclose for many reasons, some being the same that we see in IPV, like trauma bonding that can happen with their perpetrator or trafficker, the fear of a trafficker, fear of all of the things that a trafficker is using to exploit them that they could follow through on. Shame, significant shame. We worked on a video project just this last few months with where I had the chance to interview survivors of sex trafficking, and I was struck by the shame that women had that have been out of the life for years, and to tell their stories that they had done a lot of work in therapy on that. Needing money, of course, and alternatives not seeming better, not having clear alternatives, not knowing other currency, and denial. The quote that I think is really chilling here too is from a trafficker: "The best victims are the ones who don't even know that they're victims." So in healthcare, we have these challenges that, you know, we have the lack of awareness and understanding that we talked about. Also, we need to acknowledge that cases don't usually present like the sort of poster child, picture perfect case of someone who's being trafficked. Many times trafficking looks like different things, other things. And I've talked to a lot of providers who've said, and probably many of you have had this experience, where you kind of like months, years later, you face palm and just say, how did I miss this? Oh, I think that's what was happening there. And you thought it was something else at the time. So obviously we did talk about staff and provider bias. There's not a perfect screening tool for all circumstances. Lack of policies and protocols, both for assessment, for treating, for clinical responses. and a lack of community resources. So if providers feel like they don't have resources for a positive screen, like if somebody does disclose and they don't really know where to connect them, how that can feel really frustrating and daunting. So now I'm going to turn it over to Lauren, who's going to lead us through some cases as we shift into talking about strategies for identifying trafficking victims.
Okay, thank you. So as Jenny said, to help illustrate some of the signs of trafficking, we're going to see 4 cases, each profiling a few details about a young person. Each case will include details at the end that we may or may not learn about a patient during a visit. So again, these scenarios represent only some of the possible signs of trafficking. And as Jenny mentioned earlier, it can often look like many other problems such as homelessness, drug use, and interpersonal violence. So in these scenarios, we're going to focus on the possible signs, and then we'll talk more about what health professionals can do in response to support youth. So we're going to start with Emily. 15-year-old Emily comes in for her well visit, and the person at the front desk and the MA both knows that she's avoiding eye contact and smells like marijuana. When the provider looks at Emily's completed risk screening tool, she notices that Emily has had sex before and has tried a drug of some kind. The provider asks a couple of follow-up questions to find out that Emily has had sex with 9 people and has tried alcohol and marijuana. The points we see here may be all that we learned about Emily during the visit, and this is a very plausible case. Some providers would say that Emily is a typical patient that they see. So if you were Emily's provider, what follow-up questions might you ask, or what would you probe for? So if you can type in some ideas into the chat box. What follow-up questions might you ask? How long have you been using substances? Are you using condoms? Where are you living? Were the 9 partners consensual? Was this protected sex? Are you practicing safe sex? Or have all your partners been of choice? Yep. Are you looking for, have you been tested? Do you feel safe in your relationships and those encounters? It's a great question. Was alcohol consensual? I would be blunt and ask, are you safe? Or are you feeling safe right now? Great. So a lot of follow-up questions about safety and choices. Excellent. So let's say you've asked those questions, and this is the follow-up information that you find out. Emily met a guy on Instagram who told her that she could model and offered to pay her for nude pictures of herself and her friends. Considering all the information on this slide, does this appear to be a case of human trafficking? Why or why not? Chat in some answers. Good exploiter with the photos, correct. You would be concerned that she's being trafficked. Yep, she's underage and sharing photos online. She's underage again. Instagram photographer is a big red flag. The blackmail and trafficker, exactly. So I think one distinction that we do need to make in here is that we don't actually know from this if Emily had actually shared the photos and if she did in fact receive payment for them. But the act of paying a minor for sexual images and of exploiting more from additional use constitutes sex trafficking. Let's move on to the next scenario. All right, this is 17-year-old Leo. So the items listed on this slide are all the things that the front desk staff notices about Leo, who's waiting for a walk-in appointment for back pain. So they observed that he was getting food from the garbage, dressed in long sleeves despite the warm temperature, and there are some inconsistencies in the answers. So the social worker was also able to meet brief with Leo before he sees the provider for his back pain. And after building trust with the social worker, this is some of the information that she finds out. She finds out that he's moved here for an education, he's undocumented, and he cleans house or does chores for a sponsor and his sponsor's friend. So thoughts here, do you think that this is a case of trafficking? Okay, some people chiming in with yes, form of labor trafficking. We would need to know more. Yep, either trafficking or abuse. Yes, ask if he gets paid to clean the houses. Would not have thought about it until this webinar today. Yep, possible high suspicion. I believe he's being trafficked for labor, asking whether or not he gets paid. Right, so it sounds like Leo's sponsor is his trafficker because Leo does chores for him and his friends. And this is probably not Leo's choice. The fact that Leo is undocumented makes it more likely that he's being trafficked because his sponsor could either threaten to report Leo's immigration status. However, from just the information on this slide, it's not definite if this is a case of trafficking. So in many situations, it's not immediately clear if a victim is being trafficked, which can be really challenging when we want to help. So let's consider another case.
And I'm going to jump in and read this comment that someone said in the chat box. Long sleeves and teen seeking make me think substance use, but not necessarily trafficking. Yep. So part of the point of this activity, and one thing that people have said is kind of frustrating to participate in, is that we don't have a, like, yes, this person is being trafficked. You can save them right now. And that's kind of the overarching message that we hope to convey here too, is that that's one of the things that's so frustrating and challenging about working with young people when they're experiencing many different kinds of trauma and problems, is that we may not have answers. So, but I think screening also for and follow up around substance use is certainly worthwhile as well.
Absolutely. All right, so 19-year-old Athena. So Athena has been in for pregnancy tests multiple times. This is her 4th visit in the last few months, and she has scars on her arm that look like cigarette burns. So from the information on this side, what would you screen for? What follow-up might you do? Yep, IPV, interpersonal violence. STIs, substance use, mental and physical abuse, do some mental health screening, wanting to know how she got the burns. Is she in an abusive relationship? Was it self-harm? Yep, pregnancy, STI, lots of responses coming in. Sexual abuse, trafficking, depression. Yep, labor or sex trafficking. All right, so now that you've asked those questions, here's what you find out. So Athena is a college student who started dancing at a strip club to pay for classes. Her boyfriend helps her make some extra money by setting her up with his friends for sex. Now, considering all the information we see on this slide, do we know if she is being trafficked? Why or why not? What are your thoughts? Do we know whether or not Athena is being trafficked? She doesn't know that, maybe she doesn't know she's a victim. How old is the boyfriend? Boyfriend is the trafficker. No, they could be all her own decisions. Sounds like a bad dating relationship. We don't know if the boyfriend is trafficking her. She's not a minor, so may not be getting trafficked. Exactly. So because Athena is considered an adult at 19, she's not automatically considered a trafficking victim. However, if her boyfriend is using force, fraud, or coercion to get her to have sex with his friends, it is trafficking. This might look like him blackmailing her with nude pictures, telling her family that she's been dancing, or taking part of the money that she makes. All right, our last case scenario is Jordan, 16-year-old boy. So Jordan comes in for a walk-in appointment at a community clinic for an STI test. The front desk person takes note of the first 2 points, that he says he's just visiting and unable to give an address, and he appears unkempt. He also is coming in for symptoms of penile discharge and discomfort. From this information, what might you think is going on with Jordan? Yep, he has an STD, STI and homeless, suspicion of trafficking, neglect, or homelessness. Yep, a lot of people saying homeless or runaway, prostitution. Right, remember that trafficking can often look like and include other problems, such as being homeless or being a runaway youth. So let's learn a little bit more about him. So you find out that his parents have kicked him out of the house and that he's having survival sex because he's living on the street. So we mentioned survival sex earlier, which means having sex for money in order to buy food and basic survival needs. Is Jordan considered a victim of sex trafficking? Yes. Seeing some yeses come in. Yes and no. Okay, yes. Yeah, so I think the important thing to remember here is that, yes, he is a victim of sex trafficking, even though there's not a third-party trafficker, right? He doesn't have a pimp per se or a trafficker. But because he's under 18, he's considered a victim, and in most states, there's a legal recognition of this. All right, I'm gonna hand it back to Jenny in just a moment, but we're gonna, sometimes when victims disclose information, like what we saw at the bottom bullet points, and sometimes they're not ready to do so. So we may or may not find out this information, which can be frustrating not to have a checklist, right, to identify when people are being trafficked or to suspect someone of being trafficked and not being able to help them leave their situation. So I'm going to hand it now back over to Jenny, and we're going to cover some strategies for what healthcare providers and health professionals can do.
So in the 4 cases that we just discussed, adults in various roles helped raise concern about these youth. So including, you'll remember, there's a front desk staff, social workers, providers. And so we'll share with you at the end of the webinar a replicable mini training that we have called a Spark that was designed to engage staff across a practice and being tuned into human trafficking. Something that I think is really helpful to think about is the various ways that roles could interact with someone who's being trafficked. So a security guard in the parking lot could notice a struggle or other conflict. Front desk staff might notice if an adult doesn't let a teenager speak at check-in or takes the teen's phone aggressively. People in various roles might notice repeat visits for certain types of injuries, pregnancies, STI tests. And providers can use additional risk screening questions to identify when adolescent patients are at high risk of being trafficked, as well as actual trafficking situations. So being tuned into those red flags and communicating across a team when something doesn't feel right can really make a difference. So now this next slide is going to show us some specific behaviors that people of any role can do to encourage young people to come forward, either at an initial visit or in the future after they build trust with us. So read through these 2 lists for a moment, and you may notice that some of these strategies are also relevant for interacting with victims of interpersonal or domestic violence. So just think to yourself for a moment, which of these strategies from either list feels like the hardest thing to do? I know I've had a fair amount of conversations with providers who talk about how challenging it can be really to do all of these, to really keep all of these in the forefront of our mind, but particularly around helping somebody when they don't want to be helped. And how do we provide support for them, recognizing that we're not going to save them immediately? Yeah, and people are also saying don't act shocked or saddened, that the entire don't list is challenging. So yeah, I am with you on that. So moving on, we're going to now look at a little bit longer list, recognizing that the points that are on the bottom part of this that are in italics are things that providers can do. So providers can mirror a patient's language whenever it's relevant, which means using the terms that a patient uses. This is familiar to you, I'm sure, but in a situation like this, it may not kind of come to mind as easily. So for instance, if a patient discloses that she's doing sex work by saying, sometimes I work for my boyfriend's friends, how might she respond if a provider says, when you're working as a prostitute, do you use condoms? Or are your traffickers' friends ever violent with you? So again, thinking about how important each word is. And then keeping in mind that if we allow our patients control over decisions whenever possible, like when we ask, I think a couple people had these examples earlier. How can I support you after this visit? Or when would you like to check in with me again? And ensuring that they have a say in their treatment options. So, and then finally, providers can enhance their standardized risk screening questions. So when asking all adolescent patients things about their sexual health, their substance use, interpersonal violence, we have the opportunity to have built-in recognizing red flags that can prompt targeted follow-up questions. So we're going to look at some examples of these now. So this slide has questions that could help identify either labor or sex trafficking. And as you read through these, notice how the tone is non-judgmental. So earlier when people were chatting in some of their ideas, a couple people asked some of these. What are you doing to make money? Do you get paid for the photos? Or so determining if they're being trafficked through that. But this could have, I think a couple times people raised the concern that a screening question could come off as too personal, too intimate, or prying. And so what are you doing to make money is kind of a general question that you might ask anyone, but could raise red flags more easily. The other thing about question 2 and 3 that I think is really a nice way to frame it, and I think I've heard this from providers who really do for other screening kinds of questions and follow-up, just normalizing. Some kids have a hard time with, some kids have been involved with, so not separating somebody out and otherizing them, but saying, this happens, and so, you know, have you been involved with that? And then that final question in italics is certainly an idea for closing any encounter with. The next slide is focusing in on CSE, or commercial sexual exploitation. And some of these questions are derived from the article that's in the inset there by Jordan Greenbaum, which is a helpful resource. So as you read through these, look for the language that shifts blame away from the victim and onto the trafficker. So what stands out to me is the phrase, did you have to actually do it? Instead of, did you do it? You see how that sort of, did you do it, implies that that victim has the power to decide. And while it's great to be empowering, we want to recognize that someone is exploiting them and someone is forcing them. So did you have to actually do it? Shifts that and doesn't make them feel like shamed for their behaviors this much or blamed. One of our nurse practitioners that we work with as a consultant on this training, she says that she often asks, what happened to you instead of what did you do? And then some examples of concrete things that someone can say to offer support to a person who's being trafficked are on this slide here. And so you'll note that some of these statements can be said by providers or staff of various roles within a clinic, so some of them can. So everyone deserves to feel safe in their relationships. I mean, that's such a helpful comment to have in your back pocket for so many different encounters with young people. It's not your fault. You are welcome here. Are you okay? I'm here to help you with any situation you're in. I think with young people, they're afraid they're going to get in trouble with their parents. And this is something that trafficking survivors in their stories often bring up about not wanting to get in trouble. So a note about trauma-informed care. It really almost goes without saying that practicing trauma-informed care is especially critical when working with youth who've been trafficked. So as I read through SAMHSA's definition here, let's consider it with a lens for human trafficking. So it's a program, organization, or system that is trauma-informed, realizes the widespread impact of trauma, and understands potential paths for recovery, recognizes the signs and symptoms of trauma in clients, families, staff, and others involved with the system, responds by fully integrating knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re-traumatization. So particularly on that last point, I think it can be helpful to think specifically what are we doing for trafficking victims to actively resist re-traumatization in the language that we use, in the body language that we use, in the ways that we convey support and lack of judgment, and a willingness to do whatever it takes to help them. Especially hard when they're resistant and don't seem that interested in coming forward. So we're going to recap some of the strategies for supporting trafficked youth that we've talked about today and consider a few more here. So being compassionate and approachable, Providers adding follow-up screening questions to the risk screening tool, either verbally or written, for cases when trafficking is suspected or a risk. So if you think, this person may not be being trafficked right now, but like that scenario with Emily, where someone offered to take her pictures, and so she may have just been vulnerable to being trafficked. And then reporting cases involving minors to CPS. Committing to additional training on trauma-informed care, motivational interviewing is key here, implicit bias, and human trafficking. And then the organizational responses are helpful too. One of the things that we think we were reminded is that when we can provide help, connect young people to tangible needs like housing, food, immigration support, healthcare, condoms, same visit LARC, emergency contraception. When we are providing those services, it is reducing their need to seek the kind of support, and I'm using air quotes here, that a trafficker might offer, financial or otherwise. Making sure that to see a patient alone and saying that that's a part of all of your visits with adolescents, like we do with all teenagers or all people your age, to normalize that and have it be part of your workflow. Creating a plan with a team or protocol for how to handle trafficking, and then having those community resources that we mentioned before. That practice-wide training on trafficking, we'll share it right at the very end of this. And just to remember that similar to situations of interpersonal violence, even when we do all these things, we cannot guarantee that a victim will disclose that they're being trafficked or that they will be ready or able to leave. Sometimes the very best we can do is to offer compassion and resources if they need them. There's not one perfect solution for every situation, and we're going to wrap up with 2 more short clips. They're about a minute each from survivors that help illustrate this.
One thing that I try to teach the girls over and over and over again is that what you've been through is not who you are. I have a few girls that are eloped now, and I spoke to one yesterday, and she's crying on the phone, and she's really upset. But I know she didn't want to tell me where she was. I know she didn't want to tell me who she was with. So, I just told her, are you okay? Are you okay? That's all I need to know. And when you're ready to talk, I'm here. And if and when that time comes, I'm here. And they just need to know that somebody's there not judging them.
Her contact information, and she said that if I ever wanted to talk to her on the phone, if I ever wanted help, she would be there. So it wasn't for quite a while later that I actually got the courage up to call her, and that turned into several months. And the message she constantly told me was that this is not who you are. People cannot define who you are, especially sex cannot define who you are. And you are so much more than this. And then she told me that I could make a choice. And she told me I could make the choice to leave. For me, it was a long, long, long struggle of me, in my mind, having to redefine what was happening to me, realizing that this was wrong, realizing this is not normal, realizing that this is not okay. And then it was the courage for me to say, this stops, and this stops now. And I remember kissing some of my siblings goodbye and just walking away.
So the reflection question about how it might feel to suspect or know a patient is being trafficked when they're not ready or able to leave. I think at this point, you probably couldn't have watched those videos without thinking about that. Just the feeling that you might have as someone who's offering support and knowing that a young person is going back out to be trafficked, I think could be very challenging, and also something for us to be aware of as not just a possibility, but a likelihood. If someone is being trafficked, that it will take them some time. I want to share a resource with you here, Polaris, which is also the National Human Trafficking Hotline. They have cards that they will send to health centers, that you can put up in lobbies, in the waiting rooms or in exam rooms, in bathrooms, keeping in mind that often a trafficker is with a young person when they're being trafficked. So bathrooms are often a good place to do that. And then they have some great services and consultation for professionals as well. So if a patient discloses that they're being trafficked, Polaris can help you and the patient navigate next steps. So those are they're a great resource to have. Also, many communities have local resources for direct services for trafficking victims or to help with food, shelter, and intimate partner violence. So having that list handy can be really helpful. So now I'm going to turn it back over to Lauren just to do our closing slides.
Great, thanks. So I wanted to share with you some other resources that AHI has available to you to help facilitate this conversation and supporting patients in your clinic. So one of the things Jenny mentioned earlier, our Sparks model. Sparks are ready to use kind of mini trainings that are about 15 to 20 minutes long. They're intended to be used with your whole health center during a regularly scheduled staff meeting or professional development opportunity. They are include PowerPoint slides, a script, handouts, and follow-up activities. So we have a long menu of Sparks that I welcome you to check out, but specifically we have one on identifying and supporting trafficked youth. So this is an opportunity to have some of these conversations that we had today with your team in your individual practices. And it will help start thinking about what kinds of protocols can we put in place in our specific health center? What community resources are available? What are some things that we should all be on the lookout when we are seeing patients, and what can each of us in our various roles do? So this is available for download for free directly on our website, so I highly encourage people to take a look. Some of the feedback that we received from people who have used this Spark is saying, I didn't have the knowledge as much as I thought, and my perception wasn't really reality. It was helpful for them on what signs they can look for, even through phone triage. And that it was a real eye-opener for them and kind of raising awareness and compassion.
I'll just add to that, Lauren, I think you mentioned that they're only 15 minutes in length, and so they're designed to be really short so that you can work them easily into a very full agenda for an all-staff meeting.
Absolutely. Some of the other resources that we have available, you know, we at AHI, we come from a perspective of all of these things can be done better if your health center is designed to meet the needs of teen patients and to be adolescent centered. And so when you have a space where teens feel welcomed and heard and valued, it's easier to facilitate these conversations. So other resources that we have available on our website that are all free and ready for you to use. This is an example of one of the posters that we have. It's also available in Spanish. But we have a number of youth-developed posters that are just visual cues that young people are a welcome and valued population. Jenny mentioned that trans youth can be at particular risk for trafficking. We have a really nice video called Voices of Transgender Adolescents in Healthcare. So the opportunity to hear from a number of trans folks on their experience sitting in waiting rooms or in exam rooms or accessing healthcare services. And this here on the right is just another example of one of the Sparks we have on confidentiality best practices, because that's certainly something that's going to come up as part of these conversations. So I wanted to just say thank you. I know we have just a few minutes left for questions. These are all of the ways here on the right that you can be in touch with the Adolescent Health Initiative, our website, our email, all of our social media contacts. Just wanted to also remind everyone that registration for the annual conference on adolescent health is closing at the end of next week. We'd love to see you in Detroit. One of my favorite things about this annual event is that half of the sessions are co-facilitated by young people. So you get to hear real-time perspectives from youth on what they want out of their healthcare services. So I'm going to go now to the Q&A box. right here, and I just, before I even look at the questions, I want to also just remind people that Jenny and I had a public health and youth development background. So if there are specific clinical questions, we could always get back to you on those. And then also recognizing and reminding everyone that the trafficking laws vary by state. So we may not be able to answer specific questions about trafficking in your state, but I'm going to pull up the Q&A box now. Okay, so one question is, do you ask the man or a possible pimp who claims to be the patient's father and insists on being in the exam room with the patient? Go ahead, Jen.
Yeah,
we both jumped in.
Yeah. So this is that example of the language that says, we see all of our adolescent patients alone. We're going to do and kind of telling what you will be doing, and then say, we'll come back to get you in just a few moments. Mm-hmm. And then having those kind of questions at the ready for that young person. Sometimes it's just not possible. Also, a nurse practitioner we work with had told me that now pimps will put like a speaker, basically like wire the adolescent patient, so that when they go in, they can still hear the conversation, and that she's been able to tell by the body language and answers of the young person that they were wired. It is true. Somebody says, I thought force, fraud, and coercion were not needed under age 18. That is true. So so let me kind of try to split hairs a little bit about that. It's kind of how you define victimhood. So states that have the safe harbor laws that protect minors, those say that force, fraud, and coercion is not needed. Philosophically, force, fraud, and coercion is not needed for a minor to be trafficked if they are engaging in any kind of commercial sex. So I think that we can all agree that they're being victimized, whether it's through, through like if they're having survival sex, or if a third party is involved in forcing fraud or coercion.
I want to address one of the questions that came up in the chat. Says if a person is a minor, oh wait, it just moved. Okay, if a person is a minor, is it okay to call the police or DCFS with a suspicion that something is wrong? I think one of the really important things to do is to consider safety. So yes, we want to be able to get law enforcement involved, but what we have heard from many providers, from survivors, and also from FBI agents is that sometimes at that moment in time, getting law enforcement involved could put the victim at greater risk. So I think really having a conversation with the young person about safety planning is really critical.
And then our child abuse specialist says to kind of always couple that with report to CPS, call CPS. So Child Protective Services is the place to call, recognizing that there are going to be times where, like we said, it's an imperfect system, but CPS should always be involved when a minor's in question.
Somebody on the chat box also mentioned medical legal partnerships, which is a great thing to try to have in place at your organization if that's available to you.
And they shared legal details can be overwhelming. I thought it was a website.
Oh. Yes, legal details can be overwhelming. So engaging experts is really great. Kind of going back, I think Jenny touched on this too, but one of the resources that we have in terms of getting a potential trafficker out of the room. So one of the things that you can find on our website is a confidential risk screening workflow that you can put into practice that normalizes that time alone, as well as some sample scripts for medical assistants, nurses, providers, et cetera, to use to sort of have those conversations with any adult who doesn't seem willing to leave the room.
This question about how to handle this situation when it's one minor doing this to another minor, which happens, and sometimes whole families are involved, and it's really, it's not uncommon. It is still considered trafficking, and it's still considered exploitation, and at the same time recognizing that the minor who is involved is like, we're kind of shifting the language. It's kind of like how we think of bullying and victim, is that the person who has been harmed and the person who is harmed. And so when a minor is involved in exploiting another minor, that we want to keep in mind the nuance of the fact that they probably have been harmed as well, and that we don't want to just simply label them as a trafficker. And just to reiterate, a couple people asked to have the slides emailed, and I think if you'll be able to access the widest range of resources if you check out the archived webinar on the School-Based Health Alliance website, where they're going to be putting that.
Great. So I'm going to give this back now to Tiara and Selena.
Thank you.
Thank you so much, Lauren and Jenny. This has been such an amazing webinar. We really appreciate it. We have a lot of questions coming in. And once again, you can still answer your questions. We will send those questions to Lauren and Jenny, and we will try to get back to you as soon as possible via email. So once again, please continue to answer your questions, and also eval has popped up on the screen. And we just want to mention that for our membership, please join us. Trainings like this webinar would not be possible without members, so we definitely appreciate you. We welcome everyone to please join us. And our registration is now open for our 2019 convention that will take place June 23rd through the 26th in the Washington, D.C. area in Arlington, Virginia. We will have awesome pre-conferences and workshops, advocacy day, rally, and hill visits, and more. So please visit our website for more information. And also on the website, you can catch our Be the Change youth program. We have scholarships that are available to help students attend our convention, covering the cost of the hotel for duration of the program. So we ask that you visit our website once again, and please see more about our convention, including this wonderful program. And we'd like to thank everyone. Once again, thank you so much for attending our webinar. And again, thank you, Lauren and Jenny. And we will definitely get back to everyone responding to your questions. And please have a wonderful day.